So our next guest is Richard McCarthy. And Richard McCarthy, Richard, can you hear me?
Yes. Can you hear me?
Okay. So Richard, as I mentioned earlier, is the executive director for the MidAtlantic part of Kaiser Permanente. He is a native of Connecticut, but he went to college at University of Virginia where he was an English literature major. And somehow he went from being an English literature major to a medical student at Johns Hopkins, which is a tough transition, I would guess, and we can ask him about that. But he's also a neurologist, trained neurologist, and he's been with Kaiser Permanente for a number of years and been the physician-in-chief for the region and also now the executive medical director. So is that more or less right, your background?
Yep, that's correct.
Okay. So how did you go from being an English literature major to going to Hopkins? It's not that easy to get into Hopkins Medical School, and I don't know that many English literature majors that got in there.
Yeah, I mean, I think Hopkins as a medical school prides itself in diversity, and actually perhaps being a literature major gave me a heads up compared to what I was planning to be, which is a biochemistry major. So I thought one of the best decisions I've made was becoming a literature major at University of Virginia. It was a great experience there and a great experience at Hopkins as well.
All right. So for those who are not members of Kaiser Permanente, what does Kaiser Permanente actually do? Tell us what it does.
So Kaiser Permanente is the largest integrated healthcare delivery system in the country. We have 12.4 million members. We serve the Mid-Atlantic, Washington, D.C., Maryland, and Virginia, as well as 8 other regions. The Mid-Atlantic, Kaiser Permanente has about 800,000 members. We have about 33 medical centers, 5 of which are 24/7 and provide 24/7 services to emergency medicine, medical observation, surgical services, interventional radiology, and ancillary services that are really equivalent to most hospitals. We, in this region, we don't own our own hospitals. We partner with some of the best hospitals in the region, including Children's and VHC, Holy Cross, BWMC, to name a few. We have about 1,600 physicians. About 600 of those are primary care physicians, about 1,000 specialists. We have 51 specialty service lines. We have about 1,700 nurses and about 8,600 employees. We pride ourselves in being leaders in Kaiser Permanente in virtual care, telephone visits and video visits, and that really served us well during the pandemic. We went from having about 14% of our care delivered virtually to about 85% of our care delivered virtually during the height of the pandemic. We take about 20,000 phone calls a day from patients. We see about 3 million members a year, and we're one of the fastest growing Kaiser Permanentes in the country, which we're really proud of.
All right, so let's suppose I move to this area and I want some healthcare coverage. Why should I sign up with Kaiser Permanente versus whoever your competitors are? What do you do that's better for me than somebody else?
Well, we have the highest quality of care based on NCQA and Medicare. We're the only 5-star Medicare program in the region, and we have the best results in terms of objective quality of care. We also probably have the best access to care, and that's particularly related to our focus on virtual care. So if you join Kaiser Permanente moving to the area, you'll be able to book a video visit or a telephone visit with your personal physician within 1 hour from initiation to being seen. Monday through Friday, we also have virtual care available evenings and weekends. And I think one is convenience, 2 is quality, and 3 is integration. So we have systems in place where, as a Kaiser Permanente member, we have access, and you have access to your electronic medical record to physicians and nurses 24/7, no matter where you are in the country or the world. And all of that is integrated. So every visit, every telephone visit, every email visit, every note, every lab test, every prescription is in our record. And as a result, we're able to set up systems of patient safety and preventative healthcare and quality that is really hard to do without the kind of system that we have.
So is COVID-19 as big a problem in the Washington area as it was thought to be? When it was a big problem in New York, people thought it was coming down here in big waves and everybody was preparing for it. And it seemed like it didn't really come as big as we thought. Is that right or wrong?
It's mixed. We did have a very high rate of COVID infectivity in the Mid-Atlantic. So looking at Kaiser regions, we were one of the highest rates of infection in the country compared to Hawaii, Georgia, Colorado, California, and the Northwest. Our peak occurred in late April, and just to give you an example, at the peak of COVID, about half of hospital admissions were COVID related. Now about 10% of admissions are COVID related. We have a mortality rate for COVID that's similar to the country, about 3.6%. We, in contrast to the rest of the country, are still declining in COVID. We still have about 100 cases a day, but much less so than other regions like Florida, Arizona, Texas, which have seen a resurgence of COVID.
I see. Is there any advantage to wearing a mask if you don't want to get COVID-19?
Yes, a mask prevents COVID spread from you to other people, even if you're asymptomatic, and also does decrease your risk of COVID.
Okay. And if I want to go to a hospital to get an elective surgery, what are the chances that I'm now going to get COVID-19 from one of your COVID-19 patients that are hanging around the hospital?
Your chances are probably less than going to the grocery store and getting COVID-19. So we have procedures in place with all of our partner hospitals to screen every elective admission for COVID prior to admission. All of the hospitals and our outpatient delivery system co-locate COVID members with protective PPE. And we, in the outpatient arena, practice social distancing. We've totally changed the way we deliver care to keep our outpatient facilities safe and keep our hospitals safe.
Now, a lot of hospitals suffered financially because COVID-19 patients overwhelmed them. They couldn't do elective surgery. In some cases, they got rid of elective surgery. How has Kaiser Permanente fared? And are you a for-profit organization or a not-for-profit?
The health plan is a not-for-profit organization. The medical groups are for-profit, multi-specialty groups. And we fared fairly well. We've actually had increased membership during COVID. We hope that's because of our improved service related to our ability to switch from in-person to video so quickly. We have had losses in terms of expenses related to COVID, and we're luckily for us, we've been very active in working down our surgical backlog. So right now, you would be able to get elective surgery both in our ambulatory surgery centers and our outpatient delivery system and our core hospitals. And we're pretty much fairly through the process of working down our surgical backlog, which we've done a lot of work on, working extra evenings and weekends.
All right. So during this COVID-19 problem, have you been managing the Mid-Atlantic part of Kaiser Permanente remotely?
I've been in the area. We have limited office hours, and both our physicians and our administrative staff have been working from home. In our clinical delivery system, about 20–30% of our care is in person, and the rest is virtual. We've seen an increase in in-person care over the last several weeks. And we're tightly managing access to virtual care and access to in-person care so we can titrate what patients want and be able to deliver their desire, whether it be a video visit with a specialist or a primary care doctor or an in-person visit with a primary care doctor or a specialist.
Now, suppose I say I think Johns Hopkins is a very good, I should disclose I'm on the board of Johns Hopkins, but let's suppose I say I think it's really good. I like your system, but I like Johns Hopkins. Can I use your system, but I go to Johns Hopkins, or it's either or?
So we partner with Johns Hopkins in some programs. We have a research partnership with Hopkins. Our model of care is that we're integrated multi-specialty group that work through a common electronic medical record. You know, I would argue that you're going to get the same or better care through Permanente medicine as you would at Hopkins, and I think the quality data would show the same.
Okay, so what would you like the Washington business community to most know about Kaiser Permanente and what they should do to take advantage of your services, but also to stay healthy?
Well, if everyone would agree to join Kaiser Permanente, I would greatly appreciate that. Yourselves, your family, and your employees. I think the thing to know about Kaiser Permanente is that we have the highest objective quality of care, the highest rate of hypertension control. If every American had Kaiser Permanente insurance, there'd be 200,000 less heart attacks in this country. We have lower rates of death from colorectal cancer, breast cancer. We have the highest preventative health care screening rates in the country. We have the best access in the country. We have the most flexibility in terms of how patients can be seen. So you can have your own personal physician and have access to that personal physician. You can have urgent care 24/7, and we partner with some of the best hospitals. And I think most importantly, we have an integrated system of care where it's all connected, so you have less to worry about in terms of your doctors not talking to one another and patient safety errors which cause harm.
Okay. So what do you do to stay healthy? I mean, you're a doctor, you have to stay healthy. Are you wearing a mask all the time? Are you exercising? Are you not doing anything bad?
I'm trying, like everyone else. I'm pretty rigorous about making sure that surfaces are wiped down, that I wear a mask in public, that I socially distance, that I don't travel as much as usual. We've stopped meeting in large groups, and I try to be careful of, for both myself and my family, of the risk that I'm taking. And I also have made a bigger effort to sleep better. I bought a Peloton, which I love, and I make sure to keep myself healthy.
All right. Do you have any reason to expect that in this region there'll be a so-called second wave of the COVID-19 virus, or do you think we basically are okay and it's going to keep going slower, lower, and lower?
I don't think anyone knows the answer to that. I hope it's the latter, that we're okay and that we're going to continue to see declining cases. I guess if we look at other parts of the country, that's probably not true, and that we anticipate perhaps in the fall a resurgence of COVID. I think the things that we can do to prevent that are reinforce the use of masks in public spaces, reinforce social distancing, and reinforce rigorous droplet precautions, so cleaning off surfaces and being careful of what we touch, not touching our face.
Well, let's suppose I say, look, I would like to get tested for COVID-19, but I don't really want to put a tube going all the way up my nose into my brain or something. So do you have any simple tests that I could get? And how hard is it to get that test, and how long does it take to get the results?
So we have excellent access for testing. So we get results. You get results within a day if you're tested at Kaiser Permanente. We have several options for testing. If you wanted a test, you could email your physician. You could set up a video visit with a physician to ask about it. That we have in-person testing sites that are available throughout the region to drive-up test. We no longer do the nasopharyngeal swab, so that's the swab that was described as a brain biopsy, where the swab goes all the way deep into your nasal passages. We have an external nares screen, which is a lot less uncomfortable. We have the ability, and we're piloting a FedEx test, so you can be set at FedEx and send the test back. It takes a little bit more than 24 hours to get those results, but we have testing available 7 days a week, and all you have to do is ask for it.
So in the Washington area that you cover, the MidAtlantic area, what is the greatest cause of death? Is it cardiovascular? Is it cancer? Is it COVID-19? Is it just old age? What is the biggest cause of death?
The biggest cause of death is heart disease, and more recently, COVID. The mortality rate for COVID here is about 3.6%. If you look at the rate of infection, which is really hard to measure because there haven't been great epidemiological studies to look at those rates, it's probably between 2 and 5% of people in the region.
Now, do you think people are dying? I think 130,000 people have died from COVID-19 in the United States so far. If we tested fewer people, would fewer people die? Or is it the testing that's causing people to die?
No, the testing is just a rate of disease. People, whether tested or not, who have COVID, the disease will progress. I think the important thing for testing is twofold. The first is from an epidemiological perspective to help public health officials decide what the rate of infection is, where infections are, and then hopefully pursue contact tracing. So one is epidemiological, and the second is anticipatory medical care. So if someone has an upper respiratory tract infection that turns out to be COVID, that has a different, obviously different outcome than a standard rhinovirus or other upper respiratory tract infection. And they can then they can be triaged depending on various parameters like their pulse ox, x-rays, et cetera, to either be we have a home hospital program, virtual care program with between 200 and 1,000 patients, or hospital or medical observation, or home with primary care follow-up. There is no cure for COVID. The most promising results have been with a steroid drug, dexamethasone. But it is important to know if you have it or not to be able to anticipate your future healthcare needs as you recover.
So if I say, look, I know I'm going to catch it, and I don't want to catch it, I'm going to stay in my house until there's a vaccine, how long am I going to be staying in my house for?
That's $1 million question. I ask all of our infectious disease experts here that question, and no one knows for sure. The answer will be determined by the availability and the efficacy of the vaccine. So there's a lot of variables. The earliest would be probably the end of Q2 of next year, and that's the earliest.
Okay, let's suppose they do come up with a vaccine. How will it be distributed? Will it go first to people in Washington, D.C. area, or will it go around the country, or how will they decide who's going to get it first?
I hope that the folks who are going to get it first are the people who are most at risk, in particular healthcare workers. As was mentioned previously, Hispanic patients, African American patients are also significantly at risk, it looks like, from the results so far during the pandemic. My hope is that we have better national leadership in terms of a distribution chain that matches risk of infection and availability of vaccine. I haven't seen a coherent plan around that. Of course, we don't have a vaccine yet either.
Okay. So I don't think I've ever been to a neurologist, but in case I wanted to go to one, what would a neurologist do for me? What's the biggest problem that neurologists have to deal with?
So we deal with everything from severe headaches, stroke, multiple sclerosis, Alzheimer's, muscular dystrophy, any kind of spinal cord or nerve problem, Parkinson's disease, movement disorders. It's a pretty large field. So any non-surgical neurologic problem, we're your doctor.
All right, so there are two things I don't want to get. I don't want to get anything, but how do I prevent Alzheimer's? I don't want to.
Probably make sure that your cardiovascular risk factors are under control. So make sure that your blood pressure is checked, that you have excellent blood pressure control if you do have hypertension. Exercise regularly. Maintain intellectuul and social activities. That's really important. And make sure to get plenty of sleep. There's linkages with sleep deprivation and Alzheimer's, as well as links with standard cardiovascular risks and Alzheimer's.
And thinking about exercising doesn't have the same effect as actually exercising?
Probably not.
Okay, and how do I prevent Parkinson's? I don't want that either. How do I prevent that?
Parkinson's is not really something that can be prevented. There's been some large studies that show that actually there's a lower incidence of Parkinson's in folks who drink lots of caffeine, so maybe a reason to have another cup of coffee. There is a risk of Parkinson's related to oftentimes childhood exposure to industrial chemicals, but there's nothing in particular you can do to, like for example, heart disease to prevent Parkinson's disease.
Okay, so the best way to live a long life is have good genes, exercise, and you know, don't go mountain climbing or scuba diving or things like that. Is that it?
And join Kaiser Permanente.
Right. Okay, that's a good answer. Dr. McCarthy, thank you very much, and I hope maybe some people will sign up for your company's business. You know, I'll look into it myself. Okay. Thanks very much.
Thank you very much. I'm honored to join you. Thanks.